Hello everyone. So Mirza Adil this side. Once again I am back with one of the newer videos. One of the report has been came for early childhood development and due to the COVID scenario, this report has not come in the last year of 2022. I was eagerly waiting for this as in one of my previous tasks while working at one of international organization, Aga Khan Foundation. So, was a district capacity building expert. I was directly looking for this project of early childhood development. So I was keen for this, and now the report for 2023 has came in this current month only. So I was going through this data, so I thought that it has to be shared with you all as well. So, so let's start on this. So the overview is that key country profile for early childhood development has been developed by UNICEF as well as in the collaboration of the countdown for 2023 women's children and adolescent health. The country profile attempt to compile in one place the available data for country and cross country monitoring. So previously in the startup when the report the first time it came like basically in the mid 2028 they have included only 91 countries profile along with the launch of nursing care framework, and after that it has been expanded to 138 including LMIC's countries, and after that in 2020 the existing profile that the same which has been done in 2019 for 138 countries has been updated in the new profile, and 59 high income countries yielding profile has been also included in the year of so that is going for 197 in the year of 2021. So likewise having a single data likewise similar data throughout the countries, uh, you will get a clear picture in the comparison with higher income countries, middle income countries. That will suggest you some of the pictures that what is the rate of early childhood development and what is the neonatal death and maternal deaths, what is going on in comparison with another countries, having the specific focus on early childhood development only. So that gives a great picture. So, the nurturing care framework for early childhood development, it's a likewise comprehensive approach to ensure childhood not only survival but also thrive, ultimately leading to transformative health and potential. This framework has been meticulously crafted by leading institutions like WHO, UNICEF, and World Bank. So, likewise, over here it's coming WHO, UNICEF, and World Bank. So, I would like to suggest that there is one of the certificate course, like from the PHFI, that I have did while working at Aga Khan Foundation in the year so 2021 only, and that was really a great nutrition course, and that is having a specific chapters on early childhood development. So you can think about that as well. So it's very low cost, like this, yeah, cost effective. So this aims to serve as a guiding roadmap, aligning with the Sustainable Development Goal to imperative survive, thrive, and transform goal laid out in global strategy on women's, children's, and adults' health. So why this is needed? This guideline is specifically on while focusing on early childhood development. Why it is needed? So investing in early childhood development is one of the best investment the country can make to boost economic, because when the baby have a good development, growth, mental, and that all, and achieving all the milestone, so they will be having a great brain, and after that they will like basically they will earn on this, and on the earning background and the skills availability and brain development and cognitive development, so that will give you incremental on Human Development Index, as well as Physical Quality of Life Index. So this will help to eliminate extreme poverty and inequality as well. Equally important, investing in early childhood development is necessary to uphold the right of every child to survive and thrive. Nurturing care not only promotes physical, emotional, social, cognitive development, it also protects young children from the worst effect of adversity as well. Parent families and other primary caregivers are the main provider of nursing care. Sustainable Development Goal and the Global Strategy for Women, Children and Adolescent Health have embraced young children development, seeing it as central to the transformation that the world seeks to achieve by 2030. That the goal, all the goals which have been set. So one of their shared target is to ensure that all boys and girls have access to quality early childhood development, like specifically Sustainable Development Goal Target 4.2. So when you will go through that all the Sustainable Development Goals, so you will come to know that key at various point of goals, it's connecting like basically early childhood development is connecting with various goals and especially the target as well. So, a risk factor for suboptimal child development, like basically inappropriate child development. So, the major thing is that key poverty and stunting risk indicates the nearly 250 million children in LMIC countries. About 40% of children are at risk of not reaching their full development potential. So, it's directly saying that key 40% of children is on the risk. The second part is conflicts. As you all know, what is going in Palestine and over there. So the child, like we see in the conflict and disaster, so displacement poses high risk to the childrens. Like on the behalf of immunity and during the conflict, the diet maintenance will not go there, and and so that develops hunger and on the behalf of hunger, that protein level is getting to be deprived in the basically specific for the children's. So that develop parts is specific to it. So the that the children will come under the that lie in the SAM or MAM category. So that is another task we can discuss somewhere later on. So due to this conflict and disaster, this will going to happen. Children globally faces advertise that impede optimal development. Adult affected by childhood adversity may earn nearly a third less than the average adult income. So when these conflict and disaster displaced child will develop or achieve their adult phase, so they will like basically they will earn in the salary part which is lesser, leading to a significant negative impact on national wealth creation as well. That directly it will affect whether your national wealth creation of your country. So there is one of the saying by Rafi: if we change the beginning of the story, we change the whole story. Likewise, ki, childhood development, if we are thinking about that, so if we will put our extra energy in early childhood development, so in the adult phase they will be going to get the good earning, so that will not deprive you of the wealth creation of your country. And the same thing like basically in the anemia cycle when we are thinking about this, so the on this background only the RBSK program has been started. That the thinking behind this key change at the beginning. So directly, nursing care discuss about five parts. So good health, adequate nutrition, responsive caregiving, security and safety, opportunity for early learning. So the nursing care like basically directly for the good health. So good health intervention received a lot of the things which is ongoing, like basically family planning. In the family planning, we are at the India level, we are having a lot of achievements, and TFR is also has been some of the deprived over there. HIV testing, prevention of mother to child transmission of HIV. ENBC, essential newborn care, including uh, kangaroo mother care for small babies, which is already which is already getting implemented. So all the staff nurses from Uttar Pradesh, sorry, and the nurse mentors having like basically on their nurse mentoring tool, they are having one of the specific checklist on essential newborn care. Immunization of mother and child. So on the behalf of immunization, Government of India is running a very immunization program at a very high level, starting from the ground root. So even at the village level, at the VHND, it's getting started. If any pregnant woman has been conceived, so she has to came over there in the VHND for the registration, either on the VHND or she can also reach at CSC and PSC. So that is implementing on in the country, our countries. Promotion of health and well-being, including healthcare seeking behavior. So on this background for at the VHND, there is a triple A meeting, Asha A&M Anganwadi meeting. So specifically the barrier which they are facing at the ground root level. So and the health seeking behaviors to change in the behaviors. So they will be counseling and supporting on that background as well. Prevention and treatment of childhood illness. So, like basically, recently one of the newer guideline has been launched, HPYC. HPNC was there previously. That in this, Asha is doing the household visit, and this is the same thing similar to the HBNC. HBYC has came that will work on the prevention of treatment in childhood illness. Care for children with development difficulties and disabilities. So in the HBYC, the ASHA has to visit, ASHA and ANM has to visit the sites, uh, and they have to seek care of developmental delays. If any identifies regarding the developmental delays, then she has to report over there. Adequate nutrition. Adequate nutrition likewise key maternal nutrition. So recently for the NFHS 5 data, if you will go through that, so there is a um, some of the issue has been happened for the anemia part of NFHS 5, if you are aware of that. So if nutrition is improper, so a lot of issues will be going to be created. So on this background, Government of India and Ministry of Women and Child Development is actually focusing on maternal nutrition. So once again, there is a new checklist. If you will go through the WHO Safeguard checklist as well, so there is a column like basically early initiation of breastfeeding for EIVF. For exclusive breastfeeding, ASHA and ANM has to be take care of this. Uh, and after 6 months complementary feeding has to be started, and in the complementary feeding at the Ministry of Women and Child Development is running, and they have one of the guideline over there that the thickness consistency of food and type of food and frequency of meal giving to the children for the who is coming for the complementary feeding, like is after completion of EVF. So Anganwadi has to be handle on this. Adequate physical activity, sedentary behavior and sleep in early childhood development, manages of moderate and severe malnutrition as well as overweight and obesity. So regarding overweight and obesity, so at the VHNE side, when Anganwadi Anganwadi has been allotted with a responsibility that she has to take weight of early, like basically there is one of the growth chart as well, WHO growth chart for male and female, boys and girls. So she has to mark on that as well. Regarding safety and security, that the third part of nursing care. So, in this safe and secure environment has to be finalized and taken care of this regarding the physical dangers and stress. So, safety and security, the first thing comes for the birth registration. Uh, if woman is taking the deliveries at our public facility, uh, so birth registration and birth certificate has to be provided over there. The next part, food security and access to clean water has to be ensured. Clean indoor and outdoor air quality. Hygiene maintenance has to be taken care. Protecting children from physical punishment. So, as today is the 1st of November, so just I was scrolling through the news. So Kenya. So Kenya came with the near implementation in their country. There is no physical punishments to the children. They have implemented in their country. Safe space to play and a safe space to play. So every development authority, like with they have to be finalized. They have to finalize about that parks in their societies. So for the safe play areas. So the fourth comes for the nursing care opportunity for early learning. So early learning for the toddlers and child. So the quality of interaction, how you are interacting with your so that gives an opportunity for their early learning and development, like basically recognition of face, is giving the smile, and identification of colors, fruits that comes. So activity that encourages your children to move their body, activate their five senses, hear and use language, and explore. Using daily routine to talk, to play, and interact with baby, toddler, child. Telling stories, including by elders. Exploring books together and reading to the baby. Talking to and with the baby, smiling, copying, and simple games. Age appropriate play with household object and people. Quality is standard in formal child care space. So early opportunity for early childhood development. So when you will go through immunization card, so a lot of developmental delays, milestone, and suggestions has been given over there for age appropriate plays that are responsive caregiving. Responsive caregiving, like basically ability of the caregiver to notice, understand, and respond to their child signals across multiple service of touchpoint, modeling and encouraging caregivers to make eye contact, smile, cuddle, praise. I will show some of the picture for this. Illness, emotional distress, interest to play, pleasure, supporting caregiver to identify and use everyday moments to communicate and play with their child. Feeding bedtime, encouraging caregiver to develop safe and mutually rewarding relationship with their child. So just have a look on this, what has been developed for you all. So, if you will go through that immunization card, so you will come to know about some of milestone. So, on the behalf of this, while working over there, I have developed Legacy 96 into 6 matrix. So, Legacy 0 to 6, as we have discussed previously on this EVF and EIVF. So 0 to 6 month baby has to be put only on the breastfeeding. So that comes for exclusive breastfeeding. So the milestone is over there, eye contact and smile while breastfeeding. Apart from this, uh, hind milk provide immunity and mm, so in the month of likewise in the village parts, so the older people might say that in the month of May or June, kindly have some water to the baby as it's very hot over here. So the message has to be given to that lady and the older person that in the milk is specific to the age wise water, that all nutrient and all content which is required for baby, it's coming in the form of milk. Even if the baby is sick, at that time also you have to give only the best feed because it helps in the brain development, cognitive development, a lot of things is happens. So for the 2 to 3 month baby, what it does, so it starts like basically identification of the face of his her mother, and any of the started passing smiles after seeing any of known people, and also starts to doing eye to eye contact, crawling starts doing, uh, and uh, jiggling their both hands and legs, and likewise that vaccine allowing pan is not coming for this annual development, that is just clear. And danger signs at the month of 3, like basically if which has been discussed as a milestone that the baby has to do, if that is not going to be passed out, so then it comes for at the danger sign, so that we have to take care of that. So so just have a look on this picture while working with Aga Khan Foundation. At the same time, I have thought I have gone through one of the research paper from the Lancet specific to the early childhood development. At that time, I thought that I will do some of the paper and some of things. At that time, I have taken this some of the screenshot with baby specific like basically early childhood development. So as discussed over here, so opportunity of early learning, that how you are behaving with your child, that is going to be learned and recognized by your kid. So if you will see that in the all the four picture that I have showing my tongue, and the same copying practice is going on over there. In the next picture, I am putting my finger in my mouth, and the same thing has been done by the kid as well. While if you are showing, you see in the third and fourth pic, if I am seeing my teeth, that the baby is also copying to me. And if you will see this, I like basically I have shown only four picture over here. I have taken this picture in the year of 2021 only, and at a different time, starting in the span of starting from the span of June to November. I have taken this all this screenshot and picture for this. So coming to the indicators which has been reported in this report. So directly discussing to that part, we have to go through indicators so that that will help us to understand it more better way. So the first indicator come for the total population, which has been shown in million for all the countries which has been reported. So for India, that the total population size of the country, data source has been taken from the UN report of 2022 online edition. Everything is online that you can go and check out. So the indicator which has been used, that has been covered in this, so we have to go through that. Under 5 likewise the total under 5 population, uh, so the total population which is coming under the age of 5 year, in the year of 2022, that the data taken from the World Population Prospectus 2022. Annual birth come like basically the number of children born each year in the country. That the same data is coming from the same source, United Nations, Department of Economics and Social Affairs, Population Division, World Population Prospectus 2022. You can check it online as well. So the next part is coming under 5 mortality. The number of children under 5 year of age dying each year per thousand live birth. So when you will compare this data with the some of the like we will discuss the next as well. If you will compare it with NFHS 5 or with um, another data report, like we see SRS, so the data will fluctuate. That will not be as same as because the data which has been captured over here, it's different source like this UN Development of Economics, that's a similar portal that covering for the all over the world, like basically different countries, all these data has been taken from the same source. So that's after demographic, it's come for early childhood development. The first come for the child poverty. So the World Bank definition of extreme poverty 2017, living on less than US dollar 1.90 per day, was used to generate a composite indicator for children under 5 exposed to stunting or extreme poverty. Under 5 stunting among young children is directly associated with poor short and long-term effect of school performance and adult earning. So that will ultimately it will going to be decreased. So percentage of children aged 0 to 59 months with height for age below -2 standard deviation from the median of the WHO growth chart. So as previously I have discussed regarding that key, Anganwadi is responsible to cover that, take the weight of all the male like basically boys and girls as per the WHO growth chart over there. So you will come to know about that key, what is the standard deviation -1, -2, and that all this details has been given on the immunization card. I will recommend you to go and have a look on that. So LBW, one of the tracking criteria, low birth weight is given while on the WHO safe birth checklist as well. On the first it has been given over there, and the second it's come under labor room register, and third it goes for the in the reporting of UPHMIs and HMIs part as well. Third comes young children is at a risk of poor development. So, for this, like I see, percentage of children under age of 5 at risk of poor development as a result of stunting or extreme poverty, as it has been discussed that you. So, in that data we will show in the figure of 2005, 10, and 2015. That one of the bar chart over there. Risk by sex and residence. So, differences composite measures to the risk of by sex and residence is over there. Urban versus rural, male versus female, and data will cover the year of 2006 2015, that complete. And the next comes in the series preterm birth. So less than 37 week completed week of gestation, the number of births has been taken who has not completed that complete 37 week, and taken delivery that they delivered before that completion of 37 week is come under the preterm birth. So this is another indicator is getting to be covered in WHO safe birth checklist as well, in the labor register as well. and all the Uttar Pradesh, and the third it's also covered in HMIS and UPHMIS data. So maternal mortality is one of the things that number of deaths of women from pregnancy related cause per live birth during the same time period. So for this, like basically just we are discussing definition. If you will go through maternal mortality, so the two type will become like basically different. There is different cause for maternal mortality is in next part. But the thing is, when you will go more detail in it, so facility-based maternal mortality is over there and community-based maternal mortality is over there, and that the guideline is on the open source. It's available, so you have to also see on that as well. Adolescent birth rate, annual number of birth to female age 15 to 19 year per thousand female age 15 to 19 year. So that's come SDG Global Database report has been taken updated on September 2023. Violent discipline, like I say, percentage of children aged 1 to 4 years who experience any violent discipline, psychological aggression, and or physical punishment in the past month. The next came Early Childhood Development Index. So percentage of children aged 36 to 59 months who are developmentally on track at least three of the following domains: literacy, numeracy, physical development, social emotional development, and learning. So that has been, this data has been taken from UNICEF. Component of nursing care health. So the component comes for antenatal care, 4 or more visits. So when pregnant women came for ANC registration and TT injection, so Asha, that ANM has to do the birth, like basically pregnancy registration, and fill one of the MCP card, Mother Child Protection Card. When you will go through in this MCP card, then you will come to know about that ki minimum 4 ANC has to be done over there. So this definition is taken over here. This again the data is taken from UNICEF Global Database. Treatment of HIV positive pregnant women. So percentage of estimated number of pregnant women living with HIV receiving effective regimen excluding single dose nevirapine of antiretroviral medicine for preventing mother to child transmission of HIV. So this report comes from Global AIDS Monitoring and UN AIDS 2023 estimates. Postnatal visit, percentage of women aged 15 to 49 years who receive postnatal care within 2 days after birth. So again, when you will go through WHO Safe Birth Checklist, you will find a series of postnatal visit while like after the delivery. Uh, Delivered woman had that she has to be shifted to the postnatal ward from the labor room. So there is a fixed time cohort and duration that staff has to visit and take care of pregnant, like with delivered woman and baby, and also she has to support in the breastfeed. So that has been given over there. For a better picture, you should go and have a look over there. Care seeking for child pneumonia. Percentage of children under age 5 with symptom of acute respiratory infection in the 2 weeks preceding the survey for whom advice or treatment was sought from the health facility or provider. So this data is taken from 2000 and 2021. So this again it's come from the UNICEF Global Database based on DHS. So component of nursing care, the first comes over here that regarding the nutrition. So early initiation of breastfeeding. Percentage of infant born in the last 2 years who were put on the breast within 1 hour of birth. Exclusive breastfeeding. Exclusive breastfeeding comes for percentage of children aged 0 to 5 months who are fed exclusively with breast milk in the 24 hours prior to the service. Minimum acceptable diet MAD is over there. Percentage of breastfeed children aged 6 to 23 months who had at least the minimum dietary diversity. So you have, like basically it has been discussed by the Ministry of Women and Child Development is having after the completion of 6 months. So they have to guide on this. Anganwadi has to be guide on this. So MAD and that all the frequency during this previous day and the percentage of non-breastfed children aged 6 to 23 months who received at least two milk feeding and had at least the minimum dietary diversity, not including milk feed and the minimum meal frequency during the previous day. So, component of nursing the second like basically response care. So, for this, no comparable data available, represented on the country page by example of indicator only. So early learning games for this children books in the home. Likewise, some of the indicators is taken for early learning. So percent of children age 0 to 59 months who have three or more children's book at home. Playing at home. So they're the same kids, children's with two or more of the following playthings at home. Household object likewise sticks, rocks, outside, animal shells, leaves homemade toys or toys that came from the store. Early stimulation at home. Early stimulation gave for the percentage of children aged 24 to 59 months with whom an adult has engaged in four or more of the following activities to promote learning and school readiness in the past 3 days. So the like basically 6 points has over there. So at least engaging four or more than four has to be over there. Likewise, reading book to the child, telling his stories, singing songs, talking to the child outside the home, playing with the children, spending time with the child, naming, counting, drawing things. Attendance in early childhood education. Percentage of children aged 36 to 59 months who are attending an early childhood education program. So, security and safety that first came for the birth registration that we have discussed, basic drinking water that when we have discussed about the conflict and war. So, basic drinking water should be available there. Basic sanitation facility that is not shared with other household. So, that has to be over there. Septic tanks or pit latrines, ventilated food pit latrines. Positive discipline, experience, like basically no any violation in the past month, including like basically explaining why a behavior is wrong. So the positive discipline and positive things has to be occur over there. So now we have came and we have reached the final things. So the demographics, as we have discussed, that the population has been taken from that the reference. So these population is for India part has been taken. Annual births data, this number of annual increment has been going to be taken, and children under five came for like was 8%, and the very irritating and this part is coming that under 5 mortality 31 per thousand it's coming, and maternal mortality 103 per lakh it's coming, as I have discussed earlier as well, that because this data has been taken from some another source, and the recent data is something else. So if you will go through that maternal mortality, so you will come to know about there is a reduction over there. Low birth weight percentage is 0.24. Child poverty is coming for 14%. Violent discipline and inadequate supervision, there is no any data. and I think that some of the research paper has to be done on this part, and it has to be available on this. Young children at risk of poor development, so it's getting increased likewise from 45 in 2000, likewise it's getting decreased. In 2005 it was 72, and now in the middle it's come for 60 in 2010, and now it's 45. So if a risk by sex and risk by residence you will take, so there is equivalent risk based on sex, that is 45%. But when it's come for residence, so it's getting changed like a scheme of 50% and 32%. So children with functional difficulty, children developmentally on track. So data is not over here, as if you will go through that HPYC guideline, and implementation is ongoing, but there is no any of the data in the public domain. So on that background, I think that's okay. They have not covered for India. So regarding like basically this component of nursing care that we have already discussed previously, that five domain. So in the five domain, the data has been collected. So in the good health, when you will go through that, so care seeking for child pneumonia is 56%. Four or more than four antenatal visits has been done by 59%. Postnatal visit is 82%. When we will go for adequate nutrition, so EIBF is coming for 41%, while exclusive breastfeeding goes for 64%, and MAD is going for 11%. The next component for nursing care goes for responsive caregiving. Responsive caregiving, public information about ECD, likewise ki data is not available. So data is likewise ki some of the paper has to be done on this, and public domain data will be available on this. Security and safety, birth registration has been fined 89%. No data on positive discipline. Basic drinking water in our country 93%. Basic sanitation has been reported 78%. On early learning, because it's very hard to find out early stimulation at home, and so data is ultimately not available. But that one of the indicators which we have discussed, attendance in early childhood education, it has been achieved for at 49. So as of now, this is only, and the next part it will come for the comparison of 2023 report with the previous one. Till the time, take care. Bye. Thank you.